Medical professionals have to weigh the ethics of their decisions every day, and for dozens of hospitals and clinics in the region, the Lakehead University Center for Healthcare Ethics can provide guidance in making some of those more difficult choices. The center is marking its 25th anniversary with a visit to the region. Lee Noonan has more.
A dozen of the region's hospitals, as well as several long-term care homes and other service providers, are partnered with the Lakehead University Center for Healthcare Ethics, sharing a bioethicist, Ryan Tonkins, who is touring some of the hospitals to the east of the region as part of the center's 25th anniversary celebrations.
Ethics is something that I think healthcare professionals confront every day.
Smaller northern hospitals would never have the resources to retain their own bioethicist, says Nipigon Hospital's CEO, Kathy Eady.
The thing about ethics is there's no right or wrong answer, and there's no, the bioethicist isn't going to be the ethics police and tell you this is the decision you should make, but they just help to facilitate the discussions a little bit more.
While in Nipigon, Tonkins is touring the hospital and meeting with staff and management to discuss some of the ethical questions they wrestle with on the job.
We might have, say, a patient or a resident in LTC who we think is making a poor choice or is maybe doing things that are harmful to them. There might be questions about the extent to which the resident has capacity to consent or the extent to which they understand what they're doing and are doing so knowingly and willingly.
According to both Tonkins and Eady, small hospitals like Nipigon face unique ethical challenges you might not encounter in a city.
We're their neighbors. You live down the street. They know your family. We talked a lot about the privacy piece of that, but also keeping that therapeutic boundary when they are your neighbors and they're asking how your mom's doing and they know your family, etc.
Someone doing many roles or there's fewer resources available, and sometimes not having the resources means that the ethical issues become much more pronounced because the right answer might involve more money or more space or more staff, but we don't have that available to us.
For patients and their families, Tonkins says it's important to understand that in Canada, ethics guidelines prioritize patient autonomy.
It's kind of like watching a close relative marrying what you think is the wrong person. Any decision that we think is high risk or something that the person shouldn't be doing, but they're expressing their own autonomy and self-determination, so they ought to be able to make that decision for themselves, as long as they're not harming anyone, I would say.
Lee Noonan, TBT News.